Hi, I'm Mary Michaels with the Sioux Falls Health Department. Welcome to the Live Well Health Feed, the show that's designed to feed your mind with helpful health information. So I've got a special guest today, Dr. Jennifer Tingley, who's the Chief Medical Officer for Falls Community Health, which is a community health center that's located within the health department. So welcome.
Thank you. Thank you.
So August, we celebrate National Health Center Week, which is all about community health centers, but we want to celebrate Falls Community Health all month long, all the time.
All the time.
All year long.
Yep.
All year long.
Yeah.
So first, let's just start with the basic question. What is a community health center?
Yeah. So a community health center is typically their primary care health centers that receive dollars from the federal government to provide medical services to pretty much anybody. So Falls Community Health, we are a primary care clinic located here in Sioux Falls.
So what are some of the services offered at the clinic?
Yep. So obviously primary care. So we're a family medicine clinic. So we provide all of that preventative care, routine, chronic medical care. Our clinic is very unique because we also have mental health services. So we do mental health counseling. We have chemical dependency counseling. We have social workers on site. And our clinic also has a dental clinic. So that's another really unique aspect of what we can do down there.
So it really kind of takes care of all the whole needs of a person.
Yeah, exactly. Yep. So it's not just somebody's physical health that we can take care of, but their mental health as well.
And I know that community health centers often target those who might not have insurance or those in some way might be underserved. But is that the only people who can come to the, or can anybody come to Falls Community Health?
Absolutely. I mean, we do like to think of ourselves as the safety net provider. So if somebody doesn't have insurance or they have insurance that is maybe pretty expensive to access at one of the private medical clinics here in town, we would be more than happy to serve them there. But we will see anybody. So private insured folks can come on down. We service the homeless. So we have a homeless grant, which means that if somebody is living at one of the shelters or out on the streets, they are more than welcome. We love to really just serve anybody that would prefer to receive their medical care at a community health clinic.
And I'm sure that over the past several months, the clinic has had to adapt
a
little bit.
Everybody, yeah, absolutely.
So tell me a little bit about how the clinic has been addressing COVID.
Yep. So one of the things we did is we decided that we wanted to keep as many people safe and not exposed to the virus as we could. And so we kind of encouraged people, if they had routine medical visits, we could do that more over the telephone or over the computer. So telehealth visits. We were really focusing on the care that we were providing on acute needs. And so we were seeing those that thought they maybe had COVID. We were seeing those respiratory, pulmonary issues. But if you had any sort of acute issue, that's where we really focused our care over the last few months.
Yeah.
Yep.
So the main clinic is located right here downtown in Sioux Falls.
Yep.
But there are other locations too. Tell me about those.
Yeah. So we have 3 clinics that are housed within elementary schools here in Sioux Falls. And we picked those school districts that did serve a lower income socioeconomic status. The clinics are located in Hawthorne Elementary, Hayward Elementary, and Terry Redland. Now we will see anybody in those school-based clinics. So obviously we love to see those kids that are attending that school, but they are open to the community. And so anybody could visit any of those 3 clinics.
And I think that's where the dental piece really comes in handy. I think, that's a fact I never knew is one of the number 1 reasons kids miss school is because of dental pain.
Exactly, yeah. So we have the dentists and our dental hygienists that work right in those schools. And so we just bring the kids on down, do their dental cleaning. If they need to have any work done, they can be seen right there, come out of their classroom, get that taken care of, and then go back to school.
What a great way to focus on that prevention piece and keep everyone healthy and
just
working or at school.
Easy as possible. That's really the point of those school-based clinics is just to make that very easy for families to access.
Well, and speaking of prevention, we know that COVID has kind of caused a little bit of disruption in some of the preventive services that people might be seeking. So after we come back from this break, we're going to talk a little bit about what you should be paying attention to with your health. So stay tuned.
Hi, I'm Dr. Salve from Falls Community Health, here to talk to you about COVID-19 today. We have done a great job here in Sioux Falls to help slow the number of COVID-19 positive cases. However, the fight is not over. As seen in other states, as they have started to reopen, the virus remains active in many communities and is often silent. That is why it is more important than ever to continue good hygiene habits, especially washing hands with soap and water for at least 20 seconds or using hand sanitizer. Covering your mouth when sneezing or coughing, and continuing with social distancing as best as you are able and wearing a mask. For more information, please visit the CDC website or talk to your healthcare provider in order to keep yourself and your loved ones safe.
Hi, welcome back to the Live Well Health Feed. I'm here with Dr. Jennifer Tingley from Falls Community Health, and we've been talking about a community health center. It's recognized during August as National Health Center Week, but we celebrate Falls Community Health all the time and all the value it brings to our community. So we've talked a little bit about the services at the clinic, but now I want to talk a little bit about just taking care of ourselves. And, you know, the focus has really been on COVID and on, you know, rightly so, we've been taking precautions and maybe keeping people out of the clinic at first that didn't have those respiratory symptoms, just to keep everyone safe. But now that we're a few months into it, what's important for people to know now about getting back to the clinic or getting back to the dentist?
Yep. I mean, just as before, we really value that chronic care management. So if somebody has diabetes or hypertension, we want to make sure that they are coming into the clinic for the necessary lab work. We want to make sure that their blood sugars are well controlled, that their blood pressure is well controlled, because people may think, I've been doing pretty well over the last few months, but how do you really know? And so we want to make sure that we bring that back into the clinic. And then the other thing that's really important is just that preventative healthcare maintenance. One of the things we've been really worried about and we're hearing about in the national media is the lack of vaccinations that have been happening. And so there's this major concern that we have a whole swath of people, and especially kids, that haven't been getting those vaccines that really will protect them from other diseases outside of COVID. And so we really are kind of focused on getting back to that routine healthcare maintenance work that's so important.
Well, and now with back to school, it's really essential to make sure that we're getting our kids in for those
routine vaccines. And some of those vaccines are required to even attend school. And so we want to make sure that those kids are getting back to the clinic, getting those shots that they need. And then as we're looking ahead to the fall, we know that influenza will be coming. That's going to be really important. Not, you know, it's important every year, but especially this year. We want to make sure that people are getting into the clinic to get that flu vaccine.
And so people should feel confident and safe, right? Coming to the clinic.
Absolutely. And so, you know, one of the things that we did down at Falls Community Health is we created a time every single day where we called it Clean Clinic. We weren't seeing any of those acute respiratory issues coming in. We wanted it to be a time where people could come in for that lab work, come in for their diabetic check. You know, if they had a chronic medical condition that made them higher risk for, you know, if they were to catch COVID, we wanted that to be a safe time. The clinic has been fully sanitized the night before. We don't have any sick people in the clinic that morning. And so that's something we are going to continue even on through, you know, probably indefinitely for quite a while, that we have those hours. But
So what's your best advice for people? Just kind of their normal day-to-day, you know, healthy living tips. What would you recommend to people right now?
Yeah, you know, absolutely. I think some of the most important just general healthcare tips is to take good care of your own personal hygiene. So trying to get enough sleep, drink enough water, eat healthy foods and vegetables, get out and get some exercise. We're in a good time of the year right now where it's not negative 20 degrees. We should be outside exercising, enjoying that sun. It's really good for your physical health, but also your mental health. Yeah,
absolutely. Well, when we come back, we're going to make a little treat, which is great for this back to school time. So if you have kids, so if you've got kids at home, this is something that they're going to be able to help with, and play a little game and get to know Dr. Tingley a little bit better at the same time. So we'll be right back. Back to the Live Well Health Feed. I'm here with Dr. Jennifer Tingley from Falls Community Health, and we've been talking about all the ways that we need to be taking care of ourselves, keeping our doctor appointments, and celebrating everything that community health centers do for the community. But now that we're in the heat of summer, no pun intended, I guess, one of the best things is fresh fruit to enjoy on a hot day. And as we think about getting back to school, we want to make sure that we have healthy snacks for our kids. So today, Dr. Tingley is going to help me with a little fruit kebab, which is easy to make. You can pick your favorite fruits that you want to be part of that. And even with melon, you can use cookie cutters and cut them into fun shapes and just build your own. So get the kids involved in the kitchen and get them eating their fruits and vegetables. But while we're doing that, or while she's doing that, we are going to come to our What the Health segment of our show, where we're going to play a little game, and we're going to get to know Dr. Tingley just a little bit better. So I'm going to let you go ahead, and we have washed and hand sanitized our hands. And remember to always wash your fruit when you come home from the store. Wash those fruits and vegetables. And quick tip, if you cut them all up, kids are more likely just to grab them for a snack too. So do all that prep work, and then they'll be enjoying those fruits. So I'm going to let you go ahead and start picking your favorite fruits and make some kebabs there. And what I'm going to do is I'm just going to ask you some rapid fire questions. So like, you know, what's your favorite color?
Green.
Okay, so it's just going to be like that. So you don't need to think about them too hard. And we'll just see a little bit
how I do.
What we don't know about Dr. Tingley. Okay, so what is your favorite city other than Sioux Falls?
Ooh, New York City.
Oh, good place. Maybe not now, but yes.
Not now, yeah. I used to live there, and so I have very fond memories of being there.
Yeah,
but
lots of good food in New York City,
so much good food.
Great place to walk,
You can walk anywhere and everywhere. Great parks, too.
Yeah. So would you rather, for superpower, would you rather have invisibility or super strength?
Ooh, I kind of like the invisibility.
Where would you go if you're invisible?
I might get myself into trouble if you say those sorts of things. What sorts of things is she up to?
Yeah, right. Okay. What is your least favorite household chore?
Oh, my least favorite household chore. So we had cats up until very recently, unfortunately. Had to put our last cat down. But cleaning the litter box wasn't one of my favorite things. Yeah, didn't love that.
Yeah, no.
That was more of my husband's job.
Yeah. Are you a morning person or a night person?
Definitely a night person. Yes. I love being up when everybody else is sleeping.
Have that quiet time.
Yeah. I've been known to be sending emails way too late at night. So.
Who was your first celebrity crush?
Oh, well, I don't know if this is a hard question. I'm going to talk about my current celebrity.
Oh, okay.
Because my kids make fun of me for it, but Hugh Jackman.
Oh, yeah.
Love him. Yeah. There's something about the singing and the dancing and
the rough and tough and the singing and dancing all in one. Yeah, I'm with you on that one. Where would be the worst place you could get stuck?
Ooh, the worst place I could get stuck. Well, I mean, obviously getting stuck on a South Dakota highway in the middle of winter would be a very bad place to get stuck. Yeah. I don't know. Maybe Congress right now. I don't know if I want to be stuck there either, but they're kind of stuck. So.
Yeah, right. Well, I think you already answered this one. Dog person or cat person?
Well, you know, we had 2 cats, but actually I'm a dog person. So, we always have dogs. So, yeah.
Another good way to get out and get some exercise is walk that dog. Yes. What is one food that you would never give up?
Ooh,
like if somebody said
coffee. Yeah. I am a coffee addict. So, yes, you won't find me without a cup of coffee in my hands most of the time.
If there were no travel restrictions, where would you go in the world?
You know, I've never been to London. I would really like to go there. That would be one of my first places that I would like to go to.
Yeah, fun place, yeah. Name something that's on your bucket list.
Ooh, something on my bucket list. You know, someday I would like to do, you know, when you're in like the Amazon and you're swinging from like tree, what is that called?
Well, just like the real Tarzan swinging or like the zip lining kind of
lining. Yeah, I've never done that, but clearly I need to read up on it. But I think I'd like to do that. So I'm not a skydiver. I'm not that much of a risk taker, but I would like to be strapped into something and slide from.
Yeah, I still have like, you know, these fears of like the line snapping or something, but I know that never happens. People are doing it all the time, but yeah, that would be fun. If you were really hungry, would you eat a bug?
Sure, I think so. Isn't that the wave of the future anyway? Or like insect-based protein.
Yeah, right.
I
so you're on,
might as well start
getting
used to it now.
Like,
I think it's coming. I could do it, I think, if I had to.
And finally, this is an easy one. What's your favorite place to work?
Well, it is Falls Community Health. I'm so proud of our clinic. I love working there. It's a vibrant, fun place to work with such dedicated, amazing staff.
Yeah.
So, yeah.
Well, we were chatting, so that kind of interrupted her, but you can see how quick and easy these are to make. And again, have the kids help you pick out the fruits, get them all cut up and prepared. Use cookie cutters, and you can cut your melons into different shapes. Really quick and easy, great grab and go after school snack or even for breakfast with a little yogurt. So you can make it fun and get those fruits and vegetables in them.
Another thing I was just thinking, without the bananas, you could throw these in the freezer. I bet that would be really good if you were to freeze some melon or some strawberries. It would be really good on a hot day.
Oh, yeah.
Anyway,
Great
just
tip.
thinking about that.
Great tip. Well, you can learn more about Falls Community Health by going to siouxfalls.org/FCH. And remember, anyone is welcome to come to the clinic. So you can contact us if you don't have a provider. We'd be more than happy to see you. Remember to keep up on those preventive screenings. And we also have some information on our Live Well website about what screenings you should have at different ages and all kinds of great healthy lifestyle information. So check that out at livewellsiouxfalls.org. And you can also follow us on Facebook, Twitter, and Instagram. So Dr. Tinley, thank you so much for joining us today, talking about Falls Community Health. And we hope that all of you have a great, safe, and healthy rest of your summer. Stay tuned for next month's issue and join us again for the Live Well Health Feed.